Hello and welcome back to the Survive and Thrive webinar series. With COVID-19 officially declared a pandemic, our daily routines have been completely affected. Every aspect of our lives, from the social and physical to the emotional and economic, are being impacted right now. As we personally and professionally adjust during these times, the Texas Oncology Foundation is turning our focus to continuing fulfilling our mission of supporting cancer patients and their loved ones by adapting and enhancing some virtual programs. We want to remain an active resource for our community. And so we urge you to stay connected with us on Facebook and check out our website. Under the programs page is where you're going to find all these additional webinars and resources on healthy survivorship. We are grateful to have Dr. Zuniga back with us. He is a licensed psychologist who practices in the Austin area. And today he is sharing with us a little bit about meditation, and then is actually going to give us the opportunity to go through a guided meditation session. So Dr. Zuniga, thank you again for being here, and I'm going to give it to you.
Well, thank you so much, Kelly, and thank you to everybody at the Texas Oncology Foundation for having me here today. And thank you for all of you for tuning in and meditating. Meditation is one of my favorite things to do. So I'm really glad we're here today. This video is open to everybody, of course, but it's also a little geared towards cancer patients, cancer caregivers, professional and lay, family members. And part of the reason we're doing this, as Kelly said, is because we're in a worldwide pandemic right now. And obviously that's a very stressful thing. And also, I try not to make a hierarchy of suffering, but if you're a cancer patient or a cancer caregiver, that creates added stressors during a worldwide pandemic. So I'm really happy to be here with you all today. As Kelly said, I'm going to talk just a little bit for a few minutes about what is meditation, and then we're going to do a guided meditation. So I'm really glad to be here. And one of the reasons I'm excited to be talking about meditation is because we are in stressful times, and we're also in physical distancing right now to try and flatten the curve, slow things down, and help our medical providers in the hospitals. And that can increase our stress load. Human beings are meant to be with each other. So one of the great things about meditation, which is what we're talking about today, is you can do meditation anytime, anywhere, for any period of time. You can meditate for 30 seconds, you can meditate for 10 seconds, or 10 minutes, or 30 minutes, or an hour. You can meditate as much as you want, in any time, any place. In a sense, all meditation is getting practice putting your thoughts and emotions on something that is skillful for how you want to be in the world. There's a lot of discussion about meditation in our society, and sometimes people think of it as this kind of mystical, nebulous, hard to do, obtuse thing that takes years and years of training. It is true that the more you meditate, the easier it gets, the more natural it gets, but meditation is actually something that's quite natural. I'm willing to bet most of you watching this video today have at some time or another, in a very healthy, normal, natural way, stepped outside of yourself and just immersed yourself in something that's sacred to you. Maybe it's the laughter of a good friend, or playing with your kids, or playing with a pet, or enjoying a delicious meal, or exercising. In psychology, we call that flow states. In the field of religious studies, comparative religion, we also talk about the idea of oceanic experiences. Being immersed in something that is sacred to you, and being immersed in something that is bigger than just you. Or in another sense, like flow states, I'm willing to bet everybody listening to this video, hopefully, at some time or another, has had an experience, again, where they step outside of themselves and they become immersed in a completely normal, natural, healthy, organic way. They become immersed in something that is sacred to them. And you kind of lose your sense of time, you lose your sense of separateness, and you just become immersed in something that's important to you. That's meditation in action. So meditation is actually something that's quite natural to all of us. And you can do it anytime, anywhere, for any period of time. Meditation is a lot like sports. In sports, you use different parts of your body or different athletic techniques for different athletic goals. Meditation is the same way. In meditation, again, you're getting practice putting your thoughts and emotions on things that are helpful for you for how you want to be in the world. And so anything in a sense can be a form of meditation. And ideally, just like as an athlete may cross train to work different, muscle groups or parts of their body, as a meditator, you get practice cross training in different forms of meditation. And this is a really key point too. I can definitely say, as a psychologist working with different kind of clients with different presenting concerns and different cultural backgrounds, there's no single best form of meditation. It is true that there are some forms of meditation, like, say, mindfulness meditation, that have a lot of research behind them, and some don't have quite as much research supporting them, but that doesn't mean other forms of meditation aren't helpful. The best form of meditation is the one that works for you in the moment. And that's another really key point that I'll say again. The best form of meditation is the one that works for you, the individual, in the moment. Sometimes you need a wrench, sometimes you need a hammer, sometimes you need a screwdriver. They're all equally good. What works for you in the moment? This is just kind of a brief introductory quick talk on meditation, but just to give you a sample, there's many different kinds of meditation. There's mindfulness meditation, lots of different guided forms of meditation. There's what we call mantra or phrase meditation, where you're using a word or a phrase. There's visualization meditation practices. There's body scans, where you kind of cultivate insight and awareness of your body, and you kind of systematically relax your body. There's what's called metta or loving kindness meditations, where you visualize giving and receiving compassion. There's all kinds of different forms of meditation. Another one is contemplative prayer, which is kind of meditation with a spiritual focus. There's all kinds of research on the benefits of meditation, both psychologically for helping with things like depression or anxiety, as well as wellness, kind of positive psychology traits, cultivating equanimity, acceptance, joyfulness, presence. There is some exciting research too neurologically about some changes in the brain that we think might happen with meditation. But again, the biggest thing about meditation is what works for you in the moment. Some of the things too I want to say about meditation are, don't worry about your distractions. You've got over 80 billion cells in your brain, and each of those cells in your brain makes tons of neural connections with other cells. Our brains are infinitely complex. You're going to get distracted. To be human is to sometimes be distracted, and you're going to get distracted in your meditation practice. It's just going to happen. Don't even let that bother you. In fact, your distraction in meditation is actually a good thing. It's a chance to bring yourself back to where you want to be. So, we're in a pandemic, and a lot of people doing this meditation are cancer patients or cancer caregivers. This audience, more than most, knows that there are some things in our lives that we don't control. One thing we can have a lot more control over is where we put our thoughts and where we put our emotions. And when you have that kind of awareness, you actually control a great deal. So if you're meditating and you get distracted, I say, good job. You're noticing your distraction. A challenge of the human condition is that we can often live in a way that's distracted and not even realize it. And then we're like, oh, where did this delicious meal go, or this afternoon, or the weekend? So being able to slow down and notice when we get cognitively emotionally hijacked, noticing what triggers us, and getting practice bringing our thoughts and emotions back where we want them to be. We call that metacognition, or awareness of our awareness, and attention control. Getting more awareness over what hijacks us and then bringing ourselves back is an incredibly powerful psychological skill. And also, one of the other things you're doing in meditation is you're getting practice, what we might say is cultivating healthy automatic thoughts. We've got thoughts, cognitions rolling around in our brain all the time. with meditation, just like an athlete works on their jump shots or their swimming technique or throwing footballs, the meditator gets embedding within their cognitive functioning and neurological processes healthy thoughts that are congruent for how you want to be in the world. So meditation is helpful for all kinds of psychological concerns. It's also helpful for all kinds of physiological concerns. Helpful with lowering blood pressure, cholesterol, skeletal muscle tension, increasing your oxygen rate. It's helpful for chronic pain management, insomnia, all kinds of factors, psychological as well as physiological. A couple other quick notes before we get started. With meditation, people will debate what's the best posture. Again, the best posture is kind of like the best meditation. The best meditation is the one that works for you in the moment. The best posture is the one that works for you in the moment. You just don't want your meditation to get in the way of, you don't want your meditation posture to get in the way of your practice. Most people find it helpful to sit up straight, to have a straight spine and neck, and have your skull, spine, and neck kind of aligned, to have your shoulders perpendicular with your hips, and then you kind of let your hands and your arms just relax. You know, you have your feet, like I'm sitting in a chair. I meditate 7 days a week. 90% I do use meditation cushions, but 90% of the time I just meditate sitting in a chair, and it's equally good as sitting on meditation cushions. You just don't want your posture to get in the way of your meditation practice. The other thing is, you know, we're talking about cancer patients, cancer caregivers, and by the way, cancer caregivers can sometimes have compromised immune systems and be struggling just like the patients that they love. And certainly healthcare workers are always under a lot of stress caring for other people, especially right now. So the biggest thing you can do with your posture is just be gentle on yourselves. Do a posture that works for you. If you need to make an adjustment in your posture, hey, no big deal. Adjustments are a normal part of life. Just let, you know, you move, you uncross your legs, you adjust your shoulders, whatever it is. Focus on your body for a minute. Do a mindful focus on your body as you adjust, and then just bring yourself back to whatever is the focus of your meditation. The length of meditation, the longer you do it, sometimes the more benefits you'll get, just like exercise, but don't punish yourself. Don't beat up on yourself. I think that, again, meditation is a lot like sports. With exercise, you don't want to overtrain. You don't want to punish yourself. You want to exercise in a way that fits in with the fabric of your life. Same with your meditation. It's better to do a little bit frequently than have these monster long sessions every so often. So if you're new to meditation, just do a little bit. Just start out slow. And where do you meditate? Again, you can meditate anywhere. It is nice if you have a special spot in your house or your office that you like to meditate in, because we are behavioral creatures, so having a kind of ritual that you can use is a good thing. A few things that I will recommend in terms of practical resources. There are several apps that you might enjoy. One is what's called the Insight Timer. Another one is 10% Happier. Two other apps that people use, one is called Calm, or another one is called Headspace. Those are 4 popular apps: Insight Timer, 10% Happier, Calm, or Headspace, that some of my clients have used. And again, try and see if any of those are helpful for you. Another resource, if you like, is my website. My website is www.drdavidzuniga, that's all one word, .com, and I'll spell that for you. DR for doctor, my first name David, D-A-V-I-D, and then my last name Zuniga. Z like zebra, U as an umbrella, N as in night, I as in indigo, G as in girl, A as in apple. DR for doctor, Dr. David Zuniga, Z-U-N-I-G-A, Dr. David Zuniga, all one word, .com. Part of the reason I recommend my website is I do try to make it a free community resource. There's literally thousands of books, websites related to oncology, healthcare decision-making, as well as psychology, counseling, and wellness. But also, I worked with a documentary filmmaker, and we shot original footage. I teach a lot of mindfulness-based stress reduction classes, and as part of that, several years ago, I worked with this documentary filmmaker, and we shot original footage, he did, the filmmaker, in California, as well as different parts of Texas, like Galveston, the Gulf Coast, the Pacific Ocean in California. And so there's over 2 hours completely free. You don't need to sign up. Feel welcome to share of videos of guided meditation, different kinds. Diaphragmatic breathing, body scan, loving kindness, one specifically for oncology, one on forgiveness, all kinds of different meditations completely free of charge. So that's another resource for you as well. The most important thing with your meditation is just have fun. Be like a compassionate scientist, trying out different things and see what works for you. So now we're going to do a little guided meditation. And I've got a little meditation bell. So right before we begin, go ahead and just maybe you're sitting on a couch, a bed, a sofa, comfy cushions, maybe meditation cushions. The other thing too about posture, people say, should I have my eyes open or closed? Try and see. They both have advantages and challenges. See what works for you. But as we begin, go ahead and take a moment. We can hold a lot of stress and tension in our bodies. Notice your body, notice where your feet are, your legs, your hips, your spine, your shoulders. Get them in a comfortable position for you. Notice your hands, and I just generally let my hands kind of rest in a comfortable position. Notice your arms. See if you can let the muscles of your face relax. And we'll use the timer. And I will begin just like that. We'll begin and end with 3 rings of time. And you can keep your eyes open if you like, or you can close your eyes. And with that, we'll begin. As we begin our meditation, take a moment to notice your breathing. Breathing in and breathing out. Breathing at your own pace. Breathing at your own rhythm. And if you like, it might be helpful to take slow, deep, nourishing, comforting breaths. And as you're breathing in and out, you don't need to force your breath in any particular way, but just breathing in a way that feels natural and relaxing to you. If you like, it might be helpful to focus on a particular part of the breathing process, like when the air first comes in and goes out, as the air comes in and goes out. Or you might like to focus on how your belly expands as you breathe in and contracts or recedes as you breathe out, breathing in and breathing out. And you might like to notice the gentle pause that naturally occurs with each breath as your body waits in its own rhythm for the next breath. Breathing in and breathing out, breathing at your own pace, breathing at your own rhythm. And as you're breathing in and out, naturally, just letting your body relax, relax. We can hold a lot of stress and tension in our bodies. For now, just letting your body relax. And as you're breathing in and out, and in and out, if your thoughts become distracted, that's okay. Distractions are a normal part of life. Just gently bring your mind back to your breathing. And when you're ready, we'll do a little body scan. And bringing your attention to your feet and noticing the toes of your feet and the bottoms of your feet and the tops of your feet. Maybe your feet are in socks or shoes, comfortably on the floor, barefoot. We do a lot of time rushing here and there. Our feet are actually incredibly complex, with lots of little bones and tendons and ligaments. We put a lot of pressure on our feet. For now, just letting our feet relax, relax as you're breathing in and you're breathing out. And as you're cultivating awareness and compassion for your body, if you need to make any adjustments in your posture, that's okay. Adjustments are a normal part of life. Just let your body be in a position that is comfortable for you. Movement is a natural part of life, just like breathing. And as you're breathing in and out, cultivating awareness of your legs and your knees. Our knees are fragile parts of our body that can experience a lot of pressure. And our legs are some of the biggest muscle groups of our body. There can be a lot of stress and tension in our legs. For now, just let your legs relax. Relax as you're breathing in and breathing out. And imagine healing oxygen going down into your legs and helping to let go of any pain or stress or tension in your legs. And moving up into your hips, your left hip and your right hip. And paying attention to how you're sitting in a chair or resting in a sofa or bed. And being aware of your posture. And being aware of the angle of your spine. And if you need to make any adjustments in your hips or the angle of your spine, again, that's okay. Adjustments are a healthy thing. Just be kind to your body and listening to your body like a good friend. Your body is probably going through a lot right now. For now, just listen to your body. And moving up into your back, our back has some very large muscle groups. We can hold a lot of stress and tension in our backs. For now, just breathing in and breathing out, and seeing if you can let your back relax and let your shoulders relax as you breathe in and as you breathe out, and noticing too your belly, your stomach, and really tuning into what it's like to breathe. Breathing in and breathing out, and not forcing your breath, but in a way that's comfortable for you. Just taking deep breaths in and deep breaths out, listening to your body and giving it the oxygen that it needs. And moving up into your chest. And maybe you can even notice the rhythm of your heart beating. And just tuning into your body and having compassion for your body and letting your body slow down. And tuning into your hands, another complicated part of our body. Your left hand and your right hand, with lots of little bones and ligaments and tendons. And noticing your fingers and your thumbs. And if you like, you can kind of gently shake your hands out and just letting them rest. And moving up into your arms and noticing your elbows. And just making sure your body is in a comfortable position for you. As you breathe in, cultivating awareness of what's going on with your body. Like a good friend, listening to your body. And as you breathe out, letting that stress and tension go. And breathing in and breathing out, moving up into our necks. If you like, you can kind of roll your neck out, kind of roll your shoulders out. In our shoulders and in our neck, we can also hold a lot of stress and tension. Almost kind of imagining a little massage, letting that tension go in our shoulders and in our neck, letting that stress go, and moving up into our facial muscles. We can spend a lot of time projecting different emotions, thinking. For now, just breathing in and breathing out, and letting the muscles of our face relax, relax. Just letting your face be the way it needs to be. And if you like, really focus on the process of breathing through your nose. What is it like on the tip of your nose when the oxygen first comes in, or when the oxygen goes out? Breathing in and breathing out, breathing at your own pace, breathing at your own rhythm, being aware of your jaw, the angle of your jaw, and tuning into your teeth, and maybe inside your mouth. Our bodies are wonderful creations, and sometimes we can ignore them. What's it like to tune into your body, to witness this miracle of evolution? And noticing your ears, and taking just a moment to tune into all the subtle sounds that are around you. And as you're breathing in and out, whether your eyes are closed or open, we can hold a lot of tension around our eyes. Just letting your eyes relax, relax. And if you like, letting the muscles of your forehead smooth out and relax, relax. And noticing the totality of your head, of your skull. And just making sure that your head is at a comfortable position for you as you're breathing in and as you're breathing out, breathing at your own pace, breathing at your own rhythm. And remembering that this state of relaxation is available to you at any time, simply by slowing down and being kind to yourself, being kind to your body, and paying attention to your breath. It's a practice you can do anytime, anywhere, for any period of time. And as we near the end of our meditation, congratulate yourself for giving yourself a little energy and attention. By caring for yourself, you'll be able to care for the other people and other things that matter in your life as well. And you yourself are worthy of self-care. Thank you so much for your meditation practice. Thank you, my friends.